Wondering, burning issues in the news as far as health is concerned is the entire issue around Charlotte Maxeke Hospital. What happens at Charlotte Maxeke Hospital? What happens there? I mean, you find yourself in a bit of a fix. Do you need money for that as well?
Well, let me just say that that also may be answered by the fact that if you see in the allocation, the minister also announced over the next 3 years extra 15.6 billion rand, which will be distributed amongst the provinces. That's in terms of looking after issues like those. Just in terms of additional allocation for infrastructure, for equipment, including also some additional staffing and also consumables like medicines, equipment, x-ray machines, cancer treatment. So all those will be coming from that additional 3-year 15.6 billion. So we welcome that as well, because then we will be able, working with Gauteng province, we will be able to address issues like speeding up the repair of the damages at the Charlotte Maxeke Johannesburg Hospital.
Are you happy with the overall allocation to the health minister? Because you look at the underlying rural areas in this country, really crippled by the fact that accessibility to health is a problem. Is it an issue of capacitating the department and the state to use that effectively, or is it an issue of more money?
Well, it's what I would call objective and subjective factors. On the objective side, the fact of the matter is that public health, it's not properly funded for many years, and it's been worse over the last, I think, at least 5 years or so, that there have been budget reductions. But from a baseline, which was always lower, if you compare the fact that the public health in terms of annual expenditure, just over 300 billion rand, which is almost the same as the entire private health service spent for 15% of the population. So the public health sector is definitely underfunded, but there's also subjective issues of improvement in management of the facilities. So we accept that responsibility.
All right, Minister, thanks very much indeed. Minister Joe Phaahla, they're giving us his idea on how those budgets can be spent. Lindsay, back to you for political comments.